Welcome to the Business of Travel, the official podcast of the Global Business Travel Association. I'm Debbie Iannaci, Head of Global Communications, Public Relations, and Research for GBTA, and I'll be your host for today's episode. Today, we're here with David Sarafinas, Vice President, U.S. Medical Assistant for the Collinson Group. Hi, David. How are you today?
Oh, very good, Debbie. Nice to be here.
Well, what we're going to talk about today is very timely, as our industry, many industries, and people in general are moving through a time where safety, health, well-being are all coming to the forefront. So really great to talk to you today about some of the medical assistance networks that you have. Can you tell us a little bit about what is a medical assistant network?
Sure. So the most important aspect of a medical network is ensuring that the patient's needs can be met regardless of what is needed anywhere in the world. Essentially, this is the core deliverable of a medical assistance network. So if you take a look at medical assistance, it's really part of travel risk management or duty of care. But under that umbrella, if we zoom into medical assistance, you have certain components. One of them is the network. Now, in my 22 years experience in travel risk management, one of the things that I've considered important is having a very strong network of medical or logistical providers. You know, although security technology gets the lion's share of the attention, everybody talks about technology and tracking and everything. Statistics insist that 80 to 85% of all calls from business travelers are going to be medical in nature.
Wow, I didn't realize that.
Yep.
That's quite a data point.
And it could be like, I just don't feel good. I've twisted my ankle. Where's the nearest clinic? I've lost my prescription medication. So, a good majority of all calls coming in are going to be medical in nature. So when we look at it that way, we take a look at the stakeholder at our client's level, and we say, what's going to cause them problems? What's going to cause their CEO to call them into the office and say, hey, I'm getting complaints from this particular person about the experience that they recently had on the business trip. Why did it happen? I would say, in my opinion, in my history of doing this for 22 years, in my experience, it's always traced back to the lack of the ability to find an appropriate provider, a doctor, a hospital, transportation to and from a medical facility. That's where many insurance companies and providers have trouble.
So talk a little bit about, interesting, the network aspect. We always think, as travelers who we're one-on-one with, but what happens behind the scenes on your end in terms of how the network is essential in providing that assistance?
Yeah, so let's use the case of an excellent network. It provides quality of services and facilities that are known and understood. You have a subset of doctors' offices, clinics, hospitals, ground ambulances, air ambulances, dental offices, pharmacies, etc. But you need to know and understand them. And you need to know that they have delivery methods to provide optimal patient outcare. So that's the key word, optimal patient outcare. You want that traveler, that employee who has a medical episode, to feel comfortable and confident right at the very beginning. These people are taking care of me. They know what they're doing. They're getting me very quickly to where I need to go. So they don't have to be concerned. Because if they are, they're going to call their spouse. They're going to call their HR office. They're going to call C-level. And that inspires a situation where there's no confidence. So the access to services has to be available without having to involve the patients in administration and payments. So we got to take that burden and responsibility completely off their shoulders because they've got bigger things to worry about. Right. I can't breathe. I think I'm having a heart attack. I'm away from my home. Am I going to, perhaps die alone, right? So you want to take all those burdens off their shoulders. You want to make sure the family members know that they're in great care. And you want to know that people in their organization know that they're being well taken care of.
And again, I think for so many travelers, there are people who don't travel because they are concerned they might something might happen or they might get stuck somewhere. We're here in the ongoing different phases of the pandemic environment, or just things happening around the world as they always do. And those of us who travel a lot for business, everybody might, I hope not, but they would have a story.
Yeah.
So when you think about how do medical assistance companies find providers?
Well, there's a couple of ways of doing it. You have to have many decades. I mean, it takes literally 20, 30. We've been in business for 50 years.
Mhm.
It takes many, many decades of experience keeping track of newly established medical and logistical providers. So you have to keep your eye open. Who's the new clinic that they just built up the street? How are they staffing it? What are their licenses? What type of equipment do they have? As well as all the other traditional providers that have been around for decades, right? Doing an annual credentialing process, making sure that the doctors that were there last year are still there, making sure that the equipment they're using is up to date, maintained, making sure that they will take a guarantee of payment, and making sure that we have that robust relationship with the hospital administrator. So we also take good pride in the fact that we keep track of every event for the last 40 years, which means if we had a bad patient outcome, bad bedside manner, bad hospital administration, we're going to notate that. And we might cross them off our list and say, this is the last place we're going to take our traveler or our patient. So we want to make sure that we keep track of every single correspondence, every patient interaction. So then we can build a nice database of places that allow us to rank a medical facility, whether they be number one, top tier, center of medical excellence, to a number four, break glass, only an emergency, and everything in between.
Right. So you mentioned the word credentials. Is that those are some of the criteria of earning those credentials for the providers? Is that right?
So we have a very extensive process that we use to credential medical providers. Not only medical providers, but logistical providers, air ambulances, doctors' offices, anything that would be used to treat one of our patients, right? So we're going to take a look, how many years have you been in business? Do you have the appropriate license? Let's take a look at feedback from other people who have been in your facility. Let's take a look at the type of equipment that you utilize. Is it state of the art? How many ICU rooms do you have? What's your emergency room look like? So we're going to send people to that medical facility, perhaps to do an on-site survey. Many times a client has a specific need for us to do an on-site medical survey. They have perhaps the idea of building a local office in the city, and they want to know that their expats and their travelers know exactly where they would go. So not only would we physically go there where our doctors and nurses and physically credential and look at the equipment with our own eyes, but we would then build a bespoke network for that particular client. Many clients have expats and they have children and they have spouses and they have perhaps family members have specific medical needs with pre-existing medical conditions. So we want to make sure that we've reached out to every medical facility to find the right service provider, where we can tell that expat, hey, if your child has this problem, this is where we're going to take them. If you have a business traveler going out there, perhaps C-level, et cetera, we want to make sure that they're confident that we've gone through all that rigor and discipline to make sure that we know where we're going to take them and we've credentialed them and they're going to be in good hands.
Well, I can tell you, even looking for a doctor or a dentist in my own neighborhood is difficult to go through that a very extensive vetting process. So I can only imagine doing that around the world for a variety of reasons, a variety of companies, clients, needs. So that's quite impressive. So how do you talked a little bit about for the expat communities in different places, but in general, how do you find providers?
Yeah, so talking about what we spoke about earlier, we're doing research on newly opened clinics, laboratories, doctors' offices, hospitals. So we're always keeping an eye on who's the new guy on the block, and then wanting to know more about them. 20 years ago, I've been doing this for 22 years. So back in the early days, there were some places in the world that had no medical facilities. The only option was to do a medical evacuation and get you out of the country, right?
Right.
Today, thanks to the world economy, some of these very remote locations have pretty good quality medical care. Great big hospital organizations have put satellite clinics in those areas, right? So we sit there and go, look, here's a brand new clinic. It's owned by a great big healthcare system based in Germany or based in the United States. So we want to do some due diligence and make sure that they are who they say they are. We're also going back to the expat community. These people live there and they talk amongst themselves and they're very willing to share. Look, I went to this doctor's office and they were great. I highly recommend you choose this person as your primary care physician. On the other end, I went to this clinic and they were horrible.
Right.
I sat there for 2 hours. They didn't have a doctor on staff. I eventually left and went to another clinic. So these are the things that we take as feedback from our own existing clients, and use that to build and enhance and augment our network.
Well, there seems like, I mean, again, I'm imagining, the globe, the world, if you will, and then I'm imagining all the things that we're talking about here today, and the level of dimension and just geographic footprint, that you have to cover. So when you think about the platform, who manages this? How does this, continue on in the best way that you've been doing it
Yeah.
for decades?
That's a good question. And there are many people in the space that don't have a network team. They outsource it to a third party, or they might even Google it at the last minute. There are some insurance companies that provide these types of services, and they don't even have their own network service. So what we do, and a good quality medical assistance company will do, is they'll have their own in-house team, 10, 20 people, whose only job is to make sure when the medical team taps them on the shoulder and says, I need resources, they're going to be able to produce. Let me kind of walk you through how might that work. A call comes in, a patient says, look, I'm not feeling good. I'm having trouble breathing. Because they're calling in on our dedicated line, we know exactly who the client is. We don't have to ask silly questions like, what's your membership number? The first question we want to know is, where are you physically located? They can easily press a button on the mobile app and we can find exactly where they're located. Once the medical team starts to talk to them and starts to ascertain this is potentially a life-threatening situation, they're going to reach out to the network team literally across the hall and say, we have a potential hospital admittance or an evacuation, spin up a solution for us. So these folks are going to be talking to a private ambulance company, talking to a hospital administrator, guaranteeing the payment so the hospital administrator knows they're going to get paid, getting an air ambulance if necessary, and getting all those resources on standby. And so at the end of the day, when the medical team or the medical director says, let's get this person admitted, we don't have to wait an hour to do all that. The work is already done. Whether they're needed or not, the work is already done. If the case is closed and it's not such a serious situation, they just put everything away, call the hospital and say we're in good shape. But we want to be ready when the medical team and the medical director says this is a go, get this patient admitted. They have everything they need. And that takes a lot of people. And that takes a lot of people to update and maintain our proprietary software program. And it takes a lot of people to have contracts with all these medical facilities. So we have to sign contracts with them to make sure that they know we're going to pay them and we know that they're going to admit our patient. You could go to a certain city or a certain hospital, and if you just walk in off the street, well, let me back up a second. In most countries in this world, if you call the equivalent of what we have 911 in the United States, by law, they're going to take you to the closest public hospital. They're not caring about the level of, abilities. They're by law going to take you to that closest public hospital, whether they can do anything for you or not. We are acting as the patient's advocate, so we want to take that call first, contact a private ambulance company where we're paying the bill, tell that ambulance company to take them to this private center of medical excellence where we've already prepaid the medical bill, and then what we call case manage and medical monitor, and follow that patient throughout the entire process to make sure that they're going to be taken care of. It costs money for all these people to have to do all these things, and it's very, very expensive to maintain a network of medical providers.
Right.
Right.
Absolutely. As you're describing this, I'm imagining how that all works. So also, and you touched on a few areas, but is there anything when we think about, the information and who uses it and how?
Yeah, so many corporations contract with us, governments contract with us, NGOs, colleges and universities, high net worth individuals, and they have their own reasons. What scares me the most are there are people out there that don't even know there is a service such as ours. They're not thinking about getting sick overseas. They're thinking about being on vacation. They're thinking about doing their sales deal. They're thinking about doing their meeting, and they get sick, and they have no idea what to do. Perhaps their first thought is to talk to the hotel concierge,
Yeah.
who's going to call the equivalent of 911,
Yeah.
who's going to get them to the closest public hospital, and that's not going to help them, right? Then there's still corporations out there, despite all the education on duty of care, they still don't have a travel risk management program because we've never had a situation in 5 years. Oh, we only have a few people who travel internationally. And Murphy's Law is going to suggest statistically their numbers coming out. And for whatever reason, it's always going to be somebody at a very senior level who hopefully is going to have a good experience, but in a lot of cases have a very bad experience. And they come back to their stakeholders and their C-level and say, we need to do better than this, right? There are laws out there, the UK Manslaughter Act, negligence to provide a duty of care. Almost in 100% certainty, if a traveler or an employee does not get taken care of or does not have a duty of care program, if they choose to litigate, they will always win. And it's going to be painful to the corporation. It's going to be embarrassing. It's going to affect morale. It's going to affect retention. It's going to affect recruiting. It's going to perhaps affect the stock price. I like to say the cost of our program is probably less than you're paying for styrofoam coffee cups, quite frankly.
Interesting.
And if you take a look at the price of 3 executive business trips, cost of a first class ticket, the hotels, etc., our programs cost less than the cost of 3 executive business trips. So there really isn't any reason for someone not to have a program, but you have to have the right program. You have to have a program that has a network of medical providers that can be invoked and leveraged instantly.
Right. Well, David, you have shared such great insights. I think, again, it's such a time when our industry, people in general, business travelers are really thinking about health, safety, and wellness on the road and otherwise. So thank you so much for joining us on today's podcast.
My pleasure, Debbie.
You've been listening to The Business of Travel, the official podcast of the Global Business Travel Association. For more information about GBTA and its work, visit gbta.org. And be sure to rate and review us wherever you get your podcasts. Until next time, thanks for listening.